This is the Neurosurgery Podcast.
Welcome back to the Neurosurgery Podcast. JP and I are super excited. We have an old friend of the podcast from Europe, Enrico Tessitore. I've known Enrico for about 2 decades. He is one of the preeminent spine masters in continental Europe. Enrico is the director of spine in Geneva, Switzerland, and the head of the EANS, the European Association of Neurological Surgeons branch that focuses on spine surgery. Enrico, welcome back to the podcast.
Thanks a lot, Mikey. Very nice to see you again. And thanks, GP, for the invitation.
That's fantastic. So, Enrico, why don't you begin by just introducing yourself again, your background? You're Italian, right? But you work in Switzerland. Give us a little flavor of where you're from and what you do.
Of course. Very happy to introduce myself. So I'm a neurosurgeon. I'm working in Geneva, Switzerland, and I am head of the spine program in Geneva, and I'm vice chair. You know very well I was chair, Karl Schaller, who started in 2007. I was already in Geneva because I came from Naples. I'm originally from Naples, so my background is my residency program was in Naples, as well as medical studies, of course. And then I decided to go abroad. I was a bit unhappy about my training in Italy, and so I decided to go to Geneva and to move for 1 or 2 years. And at the time where Nicolas de Tribolet was the chief of the unit there. So, of course, a very well-known surgeon, a great reputation, great center. So I fell in love about Geneva, about neurosurgery there. And so, and they fell in love about me, I would say, and they asked me to stay. So it was originally 1 or 2 years, and then now it is now 25 years that I work in Geneva. And so I was asked to build a spine program. Spine, of course, was already part of the activity, but was a minor part of the activity in 2001 when I did arrive. So it took me, I would say, a decade to build a true spine program. And in parallel, I mean, I also became Swiss citizen, so very happy. I'm Italian and Swiss now, so there is a good mixture between, I would say, an Italian background, a bit of artistic background, and then becoming like a bit more precise and like a watch, a Swiss watch, you know. So I had to work. I had to work on myself as well, but very happy to have built a program in Geneva, and I started to introduce new techniques, new technologies already in 2005, six, and now I have a very motivated team working with me, and so I plan to stay in Geneva, of course, and that's what I did in the last 25 years.
Yeah, well, Professor Tessitore, I love that analogy because that spine surgery, right? The artisanal side and the technical side, blending the
Exactly.
Italian and the Swiss, and my mother's side of my family comes from Naples in Italy, so I feel the connection. I do want to. We'll get all the shout outs out of the way right here. We got to meet in person recently at the EANS course that I was at in Sofia, Bulgaria, which was phenomenal because this is not your first time on the show. For our listeners, back when we did our series covering the COVID pandemic and how it affected hospitals across North America, but across the world as well, Dr. Tessitore was on then. So I'll point our listeners back to that episode. But it was so great to meet you face to face after talking all those years ago. Now to have you back on the show where we can see each other, we're doing video now, and to meet your phenomenal resident. We were just talking about Simone Grano, who was a great friend while I was there with you all in Sofia, and showed me so much of the wonderful things you were doing. And between what he's been showing me, we've kept in touch since the course, and some of the lectures you gave at the course showing the incorporation of minimally invasive techniques, and especially the new ways that you're treating traumas and fractures there in Geneva. Why don't we dive right into the novel side of your practice, the new techniques and technologies you're developing, and talk about some of these things that you've brought in the 20 years you've been there in Geneva?
So first, I'm very happy that you are talking about ENS. I mean, now
Yeah.
that as Mike introduced me, I'm the new chair of spine section. So we try to be active in research and education, and it is fun. And I was mentioning before that I've been trainee ENS trainee between 2000 and 2003, and I went through all these courses, and I still have a lot of friends from that time, and now we are faculty for these courses. So ENS is a big community, is a community focused on research, education, and of course sharing knowledge. So I'm very happy that you mentioned it, and that we do have these courses that are on the 4 years rotation, where we do meet together with 200 participants, and for different topics. So going back to the second question, of course, I was very proud and happy to have the chance to join the Geneva team and the Geneva hospital, because Geneva is a very nice city, of course, but it's also extremely interesting. It's a mixture of cultures, and there are a lot of medtechs, a lot of companies, a lot of international big companies. So there is a lot of money here to be injected in health development and in new technology. So I did introduce quite a few things, and I started with MIS, because when I arrived, I learned with the classical open approach, and I started to do ENS. And of course, I was talking very often with Mike about also the concept of the ERAS, the enhanced recovery after spine surgery. So now we do have our fast track, thanks also to Mike and to his teaching. And so then technology wise, we have the chance to have, of course, navigation, and since 1 year we do have robotics. We do use the accessory GPS, and by the way, I used the first robot. It was in 2010. It was the first version of spine assist robot, and then in 2015 we decided to move to the navigation systems. So we did acquire two navigation systems, and nowadays we go back to robotics. I think there is a big interest in this technology, allowing for more MIS procedures, increased precision and accuracy for screws, and then it's exactly aligned to our philosophy. So our team, actually, we work like a bit in UK. We are consultant. Of course, we have one chair with Carl Schaller, but I'm doing, for example, myself only spine surgery since 15 years now. Do not do any brain surgery anymore, and so this gave me the chance to really develop my skill in a specific field, and increase my knowledge at most, and also apply these new technologies. And I did introduce endoscopy as well. I did introduce lateral anterior approaches, cavitary approaches, and I would say that I developed a very special interest to the craniocervical junction, and the cervical myelopathy. These probably the two, together with MIS and robotics, the two fields where I also do clinical research, and I'm very happy to have a team supporting me.
Yeah, Enrico, it's very interesting, right? You're in Switzerland, and when I think about the world, the entire globe, right? It's probably timely to think about the entire, world that we live in, the planet Earth. And you think about the history of spine in the last, let's say, 50 years, right? And probably, and I don't want to be exclusionary here, but there's the world of the North American developments, right? All the things that happen in North America. And there's this other world that if you are in America, you may not hear a lot about, which is, of course, originating from Switzerland, a little bit more German Swiss, the AO, right? More
Yes.
Zurich. But Switzerland's a small country, right? So Zurich, Geneva, they're close. But the whole AO world that's out there, and the AO principles and the education of AO around the world, all through even smaller or third world countries, you see this happening. You have a lot of involvement in the AO, right?
Yes, it is true. I mean, AO Spine, ENS, and Eurospine, by the way, this is also a big society. But AO Spine was a very nice example how the Swiss quality could really reach the medical community. And they, of course, started by ortho, peripheral, but then moved very soon to spine. And we do have a lot of courses, a lot of events. I'm pretty sure that you went to Davos. They have an annual meeting with courses online, on site, with case discussion. Is extremely well done. And we do have a neuro officer and we do have an ortho officer. So it's a mixed community. This is also important. And having been the president of the Swiss Spine Society, I have been always in favor of mixing the two communities, ortho neuro, because this is the only society in Switzerland putting together the two specialties. And so I worked a lot also in the recognition of ortho and neurosurgery together and with a spine master certificate. Because nowadays in Switzerland, we did introduce since 5 years now, we don't have a spine specialty, but we have a spine master certificate where you have to spend 3 years in a recognized center for training, and then you have your master title. And so this is a lot of work. This is done to have an education and increasing the standard of quality in spine activity across Switzerland. And working in these foundations or societies is, of course, extremely important. So I'm pretty much involved in all this.
That's a very interesting topic, Professor Tessitore. The neuro versus ortho side of spine surgery. We in the States also don't have spine as a dedicated single track surgical training program, although people have talked about it at very high levels about trying to develop that as its own residency, its own training course, but it hasn't happened yet. I wonder if you could talk a bit about then perhaps either in Switzerland or within your experience and knowledge across continental Europe, what different patterns do you see in spine practice between neurosurgeons and orthopedic surgeons? In the States, there's obviously a lot of overlap, but I'd say that orthopedic spine surgeons still tend to have more ground in pediatric deformity, for example. Neurosurgeons, of course, intramedullary tumors and spinal tumors, that tends to be more within the neurosurgery purview. But what are the trends across Europe in the ortho versus neuro practice patterns?
I would say is really variable according to the regions and countries.
Hmm.
I can tell you, of course, about the Swiss situation, and I would say that I was very lucky because when I came to the Swiss French part, where Geneva is based, the spine surgery was and it is still in hands of neurosurgeons. So
Hmm.
GPs, in most of the cases, apart from pediatric deformity, they send patients having spine problems to neurosurgeons more than ortho. Okay,
Hmm.
of course, we had the development of some ortho spine surgeons in Geneva as well in this region, but this is completely different. I would say the opposite in the eastern part of Switzerland. In the German part of Switzerland, ortho spine surgeons were more present and active than neurosurgeons. So we tried by building the new society, quite new societies, it is now 15 years, Swiss Spine Society, try to put together two communities and try to balance a bit across the country. But I would say that going back to the specific focus, you're absolutely right. I mean, ortho, they are mostly focused on deformity, pediatric deformity, and the neurosurgeons mostly on intradural, on degen stuff, And so we, for example, in Geneva, we do have, I would say, around 1,500 surgeries in our hospital, all confounded, and 70% are spine procedures within neurosurgical department. The ortho guys, they do less, a bit longer case, of course, because of deformity takes time. And the pediatric hospital is apart. So they do have specialists doing pediatric deformity. And this is more or less the situation in Switzerland, although in some cities like Basel, St. Gallen, and also in Zurich, there are some spine units where the two teams work together, which is not the case in our hospital.
Enrico, can you tell me a little about what's happening in continental Europe? I've heard, like from my German colleagues, about this move away from fusion. That there is some kind of a push to do less and less fusion surgery, and to me, that like it kind of goes away some of the fundamental principles in the AO. But can you tell me what's really afoot there? What's really happening?
I'm very happy you're asking this question, Mike, because there is a trend. There is a trend to move away from fusion, or I would say unnecessary fusion. Okay, and this probably came out after these papers on Degen spondylo, where probably adding fusion was not really adding a benefit in terms of
The
outcome.
Scandinavian papers, right? The papers from
Yes,
Scandinavia.
exactly. Yes, exactly. Scandinavian papers. So since then, I would say, for example, going back to Degen Spondi, I would say that in Europe, in most of the countries, probably apart from France, where they do love screws and fusion surgeries, we do in most of the cases MIS decompression as a standard primary procedure, unless there is a clear, for example, symptoms of instability or radiological signs of instability. But again, it is true. You're right. In Europe, we are moving a bit away from fusion. We try to go to MIS decompression whenever possible and try to postpone the fusion the latest possible.
Yeah, talking about trends in Europe, one of the things that has been very elucidating for me in this series of conversations, getting to speak with surgeons across continental Europe, is talking about the training. And obviously, I'm still in training myself, so I have an interest in that. But there have been great changes in training paradigms in the United States and across continental Europe in the last even 5 years, much less 10 or 20 years, with work hour restrictions, access to procedures, responsibilities, and independence and oversight when on duty. Talk a bit about what the training is like at your institution and your view on how training has evolved in Switzerland and across Europe.
I must say you're right. The training evolved dramatically after the work restriction hours issue, And so when I did arrive in 2001 was not the case at all. But then we had to apply this law and this rule. So now the training takes a bit longer because they fulfill their logbook, and I would say that it takes 6 or 7 years to become a neurosurgeon and a board certified neurosurgeon by the Fédération Médicale Helvétique, FMH. And so they are allowed to do 4 years in the main hospital, but then they have to rotate in minor hospitals, cantonal hospitals, state hospitals, or non-academic places, and then fulfilling their logbook. And and they go to the official exams, which is, by the way, the written ENS exam, and then they do have the oral exam. And apart from that, of course, they are really pushed to go abroad to do 1 year of fellow somewhere, and then it's according to specialty. But it takes now probably at least 7 years to have the catalog done because
Yeah,
of the
and
restriction hours, our work restriction hours.
what are the hours in Switzerland now? What are the limits per week?
The limits per week for a resident, they are at 80 hours now.
80 hours. And I hear
80 hours.
some countries like England, it's even lower, right? It's in the
Even
15.
England is lower. England is lower, but they have a different system. But they cannot work in a row, for example, more than 3-4 days. They have recovery time. So I have the impression that, of course, this is very fragmented. If they do a rotation or on call during the weekend, they are almost a week off. So this is also a problem for follow up our patients, because they do see many doctors rotating, and of course we as a staff, we are there, we are a bit more in continuity, but I mean this was a problem at the beginning, because follow up our patient was at risk at the beginning, and now we did find a good balance for that.
So Enrico, tell me this, because Europe, to me, it's interesting. I always tell my patients, United States is big. It's like all of Europe put together. It's like, Albania plus Portugal plus Finland, right? And there's a lot of truth to that. But in the US, our system is regulated nationally and then also at the state level. So medical licensure is state level. But for example, residency programs, it's nationwide, right? Like all residency program standards are basically nationwide. Now, how does that work in Europe? Because Switzerland's right in the center, and you're the most peaceful country too. So people go from Poland to Spain, and then they train in different places, and the standards are a little bit different, right? So how do you circle that square? You alluded to this about when you started in Italy, and then you moved to Switzerland. It was different, right? How is that?
Very different.
How is that reconciled?
But I would say we have the chance that in Geneva again is very international. So we have a lot of foreign residents as well.
Hmm.
They come to us. Either they do integrate the Swiss training program, either they do 1 or 2 years with us, and then they go back to the original training program. Can be in Italy, in France. We have a little bit less from Germany, because we do speak French in Geneva, as you know. So we have a lot of exchanges with different spine program, which is extremely rich to us. I mean, extremely important to us, because we can benchmark with other training program. But I would say that in Europe, the training is mostly done in the originary country, unless you move abroad to do the world program abroad. So we do have exchange programs, of course, with Italy, because I'm very well connected in Italy. We do have with France, we do have with UK, a bit less with the eastern part of Europe, and we have to integrate them in our training program. And we are very happy to have these exchanges. And we also had some Americans, by the way. So it's a bit difficult for an Americans to be recognized for the practice in Geneva, and they need to go to a final medical examination at the end of medical studies. They need to work 2 or 3 years under our responsibility, and only after that they can be actually recognized as Swiss doctor. So for US we do had few. Araya is one of this resident. He was working with microfillings in Canada. Then in Cincinnati with just Chang, and he came to us. And then we also had Gregory, was originally from US. So we do love these changes, and we do learn a lot. We do learn a lot from that.
Well, what a perfect transition to the last thing I wanted to ask you about while we have you here. Obviously, the current chair of the EANS spine section, Dr. Wang, former chair of the AANS CNS spine section. And before we started recording this interview, we were talking about how much you want to increase the connection and the exchange between Europe and America, Geneva and America, when it comes to spine surgery, and collaborate more, share more knowledge, share more techniques. So but while we still have you, make a pitch to our American listeners and anyone listening in Europe as well for the value of exchanging ideas, techniques, cases, tips, tricks, and just making friends across the pond.
But I would say that this is a big chance to me. There is a big chance to talk to American surgeons. Of course, I know a few of them and try to be active, but still there is some distance. And I would say that this podcast is the first step of bridging the two communities. And of course, being chairs of these sections will be much easier to us to try to connect better. And we do have some, as you know, some residence exchange program. We do have the possibility from Europe or US to participate to training courses, as you did. So I think we need to promote this a bit better, and to try to organize joint meetings or joint venture where we can exchange. And especially for young people like you, extremely motivated, extremely smart, we will be very happy to welcome you in Europe. So definitely we need to improve this collaboration. And having I must say, a big consideration to Mikey in his work, and being a very good friend of him, I would say that this is a good starting point.
Well, Enrico, thank you for sharing your time with us. I know it's late there in Geneva. We're going to let you go, but we have to have you back on. Look forward to seeing you again soon and increasing the collaboration across the pond, across the Atlantic between the US and Europe.
Definitely motivated to do it. Please count on me. And then again, thanks a lot, Mikey and JP, for the invitation. Have a nice day. Yes.